Good afternoon. My name is Stewart Layhe. I work for Denver Health, where I'm the Supply Chain Project Manager. And I'd like to spend 5 or 6 minutes just talking about the difference between perpetual inventory and PAR inventory. So PAR inventory, or Periodic Automatic Replenishment System, is a way of controlling your inventory where you do not know what is in stock at any moment in time, as opposed to perpetual inventory, where every product that's moved in or out of one of your warehouses is logged into a system. So if you look at perhaps the clinical level or the unit level, you're probably going to see perpetual inventory appear as perhaps a Pyxis machine or an Omnicell machine versus open shelving, which is PAR inventory. So the perpetual inventory appears to be more scientific and more accurate way of monitoring your inventory. You do have to be careful, though, about controlling the ins and out transactions. You do need to make sure that people are actually doing the transactions. It has the veneer of science, but you need to make sure that actually happens. There will still be a need for cycle counting, so you don't effectively get rid of the need to count, but you reduce the number of times you need to count. Perpetual inventory provides you a way of automatically ordering product. Because the system knows how many is in stock today and how many you need to have in stock, at any moment in time, you can run a replenishment report and the system will place a purchase order, or maybe a pick order, that will bring your inventory back to the PAR level. With a PAR system where you don't know what's in stock, the only way you know how to order is by physically going to that location and doing a count. Once you've counted, then you know how many that you can reorder. On the finance side, of course, with perpetual inventory, you know at any moment in time the value of your stock. With a PAR system, you don't know what's in stock at any moment in time. You don't know what's on the shelf. And this is where we normally end up having to do that famous Christmas, end of year physical count, which may take 1 or 2 days. Whereas with a perpetual inventory, typically you just cycle count once or twice a year, or whatever your finance department tells you. The downside of the perpetual using Omnicell and Pyxis can be that nurses tend to shop sometimes. So for instance, the nurse doesn't quite know what size product to take, so we'll take 4 different sizes of a product out of a machine at once. If you happen to run your replenishment cycle during that time, you'll recognize all 4 are below the max stock, and you'll go to replenish them. And then by the time you get to the machine, the nurse has brought back the 3 sizes he or she didn't use, and now you've got no room for stock. You have to take it back downstairs. So there are drawbacks to having perpetual inventory. You can automate what we talk about as a PAR level, as open shelving, by using handhelds. A lot of companies have barcode labels on their shelves, and you can use a handheld just to scan the barcode, key in how many products you find on the shelf, and the system will do the calculation of what to reorder for you. The important thing is you still have to go up there and scan the product. You can't do this remotely as you could with perpetual inventory. With PAR data, the other problem you have is on the usage. So again, if you compare that to a perpetual inventory, the great thing with perpetual is I can see when product is leaving that particular Omnicell or Pyxis, so I can get some feel for what point in the day that the product's being used, and that might be important to you. With a PAR, you only know at what point you replenished it. So that really is talking at the clinic or the unit level. When it comes to a stockroom or a warehouse, a true warehouse, you will see very few that use a PAR level. Everything tends to be much more automated in a warehouse because you need to have that level of control. And you may have certain locations in your own hospital that are on perpetual. You may have a central supply, a central sterile that is on perpetual inventory. Again, you just need to be careful about the level of security you have in that department. You don't want people coming in and helping themselves to stock without the system knowing about it, because that's a recipe for you running out of product while the system thinks it's fully stocked. So just be careful on the security and the level of control. And again, maybe if it's a central supply or a central sterile, you need a level of data mining to be able to look for patterns and trends and seasonality. You might find that much easier in a perpetual than you would with a true par cycle. So at that point, I think that describes, I believe, the difference between the two. Thank you for spending the time with us. We appreciate it.